Good morning. This is Dr. Jim Waller from Tri-State Colorectal in an undisclosed location in warm, sunny Fort Myers, Florida. Thought I would take this opportunity today to talk with you about a very common condition involving the anal area, or as a lot of us oftentimes call it, the rectal area. And this condition is called pruritus ani. Kind of a funny word. It's actually a Latin phrase which means itchy butt. Itchy butt, or pruritus ani, is one of the more common conditions that we take care of in colorectal surgery. In fact, this condition is most often confused with a hemorrhoid problem. And if you've seen me do one of these broadcasts before, you know that one of the things I point out is that almost anyone presenting with a problem, whether it be a patient or whether it be a physician who is referring a patient to us, almost always they're referred to us with a hemorrhoid problem. And most often, that patient coming in with an anorectal issue does not have a hemorrhoid problem. And in fact, one of the more common things that we see in our office is something called pruritus ani. Again, itchy butt. You may understand a little bit of what I'm telling you when you think about some of the TV commercials that you will see. I remember the first time that I noticed an ad on TV for one of the topical creams, and they made the point that relieves the burning and itching of hemorrhoids. Well, burning and itching is not a common symptom of hemorrhoids. It is a common disease, and in fact, I would say one of the top two conditions that we see coming into the office. And again, most often this is mistaken as a hemorrhoid problem. So what pruritus ani consists of is irritation. Again, I like to use my hand as a model. If this is the your external anal canal, the skin lining the external anal canal, the perianal skin, this area right here at or near the opening is where the problem occurs. It's not coming from inside the rectum. In fact, as you've heard me discuss before, the internal lining of the rectum really has no pain sensitivity whatsoever. So this is burning and itching, which is involving the perianal skin right at the external opening, and it can be quite disturbing. All of us, I'm sure, at some time or another, have had some burning and itching in the anal area. Anything that causes you to have diarrhea, where that you're having frequent loose stool, anything that can create irritation of that external skin can result in burning and itching. When we refer to pruritus ani, we're generally referring to a chronic condition, something that a patient has had over many weeks or many years. And in fact, this can be a condition which is very difficult to treat and which can occur over a lifetime. Uh, Anything, as I mentioned before, that causes irritation of the perianal skin can give you burning and itching. And when taken to the most extreme examples, that burning and itching gets to be can be very, very painful if the skin becomes extremely excoriated, where you develop cracking and significant inflammation of the skin. It can be very painful. The most common causes of chronic pruritus can be chronic loose stool. Stool in and of itself is an irritant. Stool is alkaline. A lot of times people feel like their stool is acidic, but that's very rare. Most of the time, stool is alkaline. It starts out, what we have in the GI tract starts out acidic, secondary to stomach acid, but after passing through the duodenum, past the area where the pancreatic enzymes and juices are secreted to help digest a meal, it quickly becomes alkaline. Uh, and it doesn't matter whether it's alkaline or acidic uh, necessarily as to whether it may cause irritation or burning of the skin. Either an acidic environment or an alkaline environment can cause irritation of the skin. But when we're talking about pruritus ani, we're generally talking about the alkalinity of the stool. So, as I mentioned before, anything that causes recurrent loose stools, which then necessitates frequent wiping. That in and of itself can cause chronic burning and itching. We also know that certain things in the diet in some people are responsible for creating the chronic burning and itching. I always told patients that it just so happens that these are things we like beer and wine, caffeinated beverages, dairy products, tomato based products, a variety of the foods that we enjoy can result in pruritus in some people. So one might wonder, well, how the heck do we take care of that? These are things I want to eat. I don't want to avoid them. How can we take care of that? How can I continue to eat some foods that I enjoy if they cause me burning and itching? Well, first of all, we never know for sure in any one individual which of those things may cause the burning and itching. My advice to patients is, okay, we give them a list of things to avoid, and my advice to them is maybe try avoiding everything at first, and if we succeed in eliminating the symptoms, then maybe add things back into the diet to see how you do. Another option is to simply try to uh, treat the area with TLC, so to speak, and that involves cleansing very gently after bowel movements to remove the stool to get rid of the irritant. It's kind of an old principle of burn therapy. You remove the burning irritant from the skin as the first thing to first way to treat a patient who comes in with a burn injury. So here, what we want to do is as quickly as possible after having a bowel movement, make sure that we clean the skin without overdoing it, because we all see patients who come in who become very fastidious about trying to keep themselves clean, and very often the cleaning itself can result in burning and itching because of the patient causing themselves um, um, just chronic irritation to the area from wiping or using agents to try to help clean themselves, which may in effect cause burning and itching and irritation of the skin in and of themselves. So we try to coach the patients on those things that we know can be related to burning and itching, and from a standpoint of things in their diet. We also then talk with them about getting the area clean after a bowel movement without causing increased irritation because of being overzealous with the cleaning of the area. Uh, One of the things that I have always advised patients to do, and I actually learned this from a patient, is I have patients take a bulking agent such as psyllium, because psyllium tends to hold the stool together. It gives patients a normal stool, as we can hope for, and quite often the fact that the patient can have a bowel movement and then find it easy to clean after the bowel movement makes it much less likely that they're going to have irritation. As I mentioned, I learned this from a patient one time who came in to see me for his first visit after being started on treatment for pruritus. And I asked him how he was doing. He said, "Hey, I'm doing great." And I said, "Well, what are you doing?" And he said, "Well, I started taking, and I have no stock in Metamucil." He said, "I started taking Metamucil, and now I have a white wipe." What he meant by that was he would go to the bathroom. He was emptying the rectum effectively. He cleaned with a little warm water after the bowel movement, um, and that in and of itself took care of his pruritus. Now that's not going to happen in most people, but once I heard his story, I started using that with all my patients. I suggested that even if they weren't constipated or didn't seem to have overly loose stool, that they try using a psyllium product to bulk the stool so that when they had a bowel movement, they were able to go. They were able to clean easily after the bowel movement, and sometimes that will make a big difference in how the patient feels. Um, it is important to cleanse the skin after the bowel movement without excessive wiping, as I mentioned before. Because stool is alkaline, one of the things that I learned from our program director, Dr. Mazier, when I did my training, was to use a little bit of vinegar and water to clean with. And Dr. Mazier always recommended about a tablespoon of clear vinegar in a quart of water. Keep that in a container in the bathroom, and then clean with some Kleenex or a cotton ball. You can try toilet paper. Sometimes toilet paper will fall apart if you get it wet. He always recommended using a Kleenex or cotton ball to clean with. A lot of patients find using a cotton ball hard to hard to do. So using a Kleenex and some vinegar water to gently cleanse after a bowel movement both removes any stool that might be remaining in the air in the anal area, while also neutralizing the alkalinity of the stool because of the fact that vinegar is a mild acid. It acts as a buffer. So just a mild vinegar water solution to cleanse with after bowel movements can sometimes be very helpful. We also use topical agents down there. One of the things I also learned from patients and continue to do throughout my entire career, once I had learned this, was to keep it simple. There are a lot of prescription creams, most of them containing cortisone. A lot of them have something called pramoxine, which is a mild analgesic that can be used in the anal area. Some have some lidocaine. Quite often, these are a little more expensive than just a good topical agent to help protect the skin. My favorite became vitamin A and D ointment, like we use on kids for diaper rash. So after cleansing after the bowel movement, and patting it dry, using some vitamin A and D ointment or some type of zinc oxide ointment, which then puts a barrier over the skin, puts a barrier over that area, and also protects the skin so that after the next bowel movement, it's easier to clean. And prevents the stool from coming in direct contact immediately with the perianal skin. So all in all, pruritus it can be difficult to it can be difficult to understand from the standpoint of, well, what is actually causing it, because we know it can be a variety of factors. So in general, we have people, watch what they're eating in the diet. Again, I don't tell people they can't have their coffee or they can't have their beer or this, that, or the other, as long as after their bowel movement, they pay particular attention to getting the area clean without being overzealous with the cleaning, applying a topical barrier to help protect the skin, and then also doing some things to help improve the stool consistency, such as taking Metamucil or another bulking agent, so that when they do have a bowel movement, they eliminate the bowel movement. It's not too runny, it's not too thick or pasty, and then that also helps with cleaning, applying a topical barrier, and helping to protect the skin. In the majority of patients, we can get them asymptomatic, or certainly reduce the number of times they have symptoms and reduce the inflammation of the skin by doing these simple measures. We do occasionally see patients who have extremely difficult pruritus ani to treat. And in some of these patients, we will do some other measures, such as having them apply things such as milk of magnesia to the area, which also helps to protect and soothe the skin. We have other types of barriers that I won't discuss here, that we may use in some patients where we just find it almost impossible to get the burning and itching completely under control. And I have to be bluntly honest here. We have some patients where this is a lifelong, very difficult condition to treat. So we certainly have measures to help treat pruritus. Should you want to see a short synopsis of some of the things I talked about, you can go to our Tri-State Colorectal Surgery website, where we have some written information on pruritus, its causes, and its treatment. And of course, feel free at any time to reach out to us via our website or via YouTube, and I will certainly get back with you as soon as I can. Thank you for listening, and hey, we look forward to your questions.